Thank you, Professor Naga. Ladies and gentlemen, I would like first to thank the Egyptian Society of Nephrology and Transplantation for inviting me during this nice congress. It's my pleasure to talk about peritoneal dialysis in Africa. It is my outline. What about end-stage renal disease in Africa and the world? As you know, we have more than 850 million of patients suffering for CKD in the world, more than diabetes mellitus, cancer, and HIV. In that global kidney health, we look at we have 3 million people living under dialysis in the world, but around 10 million of people need dialysis without having access to this renal supplement therapy. And in 2030, we will have more than 10 million of patients who need dialysis but without access. And most of that population will be in developing countries. In that slide, we see that the prevalence of dialysis patients in the world, you have more patients in Europe and North America, but here you see that in Africa and in Oceania, the prevalence of patients living with dialysis is very low, and it's in the low and low middle income countries. Here is Africa. It is a huge continent, and with 55 countries, with a population of 1.3 billion of people. In that review in Lancet, we show that 96% of adults and 95% of children died in Africa without dialysis. And 84% of adults in incident end-stage renal disease cohort and 5% of adults in prevalent discontinued dialysis, many times because this patient pay out of pocket in the many situations. What modality of kidney renal replacement therapy in Africa? As you see in blue, hemodialysis is the most prevalent modality. And in green, you have kidney transplantation, but as you note, PD in red is in a low prevalence. In that survey made by ISN Africa, we show that most dialysis patients in Africa is from the northern Africa. Here you have Tunisia, Libya, Egypt, Morocco, Algeria, and Mauritania. And after, with a prevalence less than 200 per million, you have sub-Saharan countries as Côte d'Ivoire, South Africa, Gabon. And you see that in the West and Central Africa, most of these countries, you have less than 10 patients dialyzed per million. These disparities in Africa, as you know, the median is 116 per million per habitant. But this prevalence is lower in Central Africa and in the West Africa. But in Northern Africa, you have more than 500 per million dialysis per habitant. In most of the countries, all the patients didn't have access to dialysis. Out of Mali, Cameroon, and Tunisia, where you have 100% of accessibility, in the other part of Africa, as in Ethiopia, in Madagascar, or in Nigeria, you have less than 10%. What about survival rate of death in dialysis? In that study in Nigeria, we noted that half of the patients died under dialysis after less than 15 days, because many of these patients are paying out of pocket. And we have different funding source for dialysis. And most of the country in Africa, you have the government funding in green, and you noted that we have a very low prevalence of assurance funding. And many patients, as in Ethiopia or in Nigeria, are paying dialysis out of pocket. What about distribution of density of nephrologists? If you're not in the high-income countries, you have around 30 nephrologists per million of inhabitants. But here in Africa, and in the low and middle-income countries, you have less than 4 nephrologists per million of inhabitants. The number of nephrologists in Africa is still very low. You have in Libya, in Northern Africa, more than 7 nephrologists per million of inhabitants. But in the sub-Saharan Africa, in South Africa, we have around 2 nephrologists per million of inhabitants. And in many countries in Africa, you still have any nephrologist. And some countries are playing a very important role in the training of nephrologists in Africa. For example, in Senegal, from 2008 to 2020, we trained 140 nephrologists coming from 19 countries of Africa, mainly French-speaking countries in Africa. And in that map, you see the origin of different nephrologists trained in Senegal. What about PD in Africa and the world? For PD in IKI, we report this experience in West Africa and in Central Africa. No, sorry. In the program of ISN, naming Saving Young Life, we have reported in 2017 in Senegal this different experience in different countries. And it is very important to note that in Abidjan, in Nigeria, in Niger, and in Ghana, we have different experience reported in the Peritoneal Dialysis International, and the number of patients is around 200 patients. Mainly young patients, pediatrician experience, and here you noted that the mean dialysis duration was 2 weeks, and the mortality rate was about 30%. What about PD in end-stage renal disease? As you know, as reported in the world, PD is around 10% of prevalence in the world, and mainly in developed countries. And when you see this prevalence in the world, comparatively to the number of population, Mexico is the first country where you have the very high prevalence of patients living with PD. But if you take the prevalence per million of inhabitants, the first is Hong Kong with around 500 per million per habitant. The prevalence of PD in global dialysis population is around 10%. But in Northern Africa, you will note that the prevalence of PD is very low, less than 2%. What about PD in Northern Africa? 90% of African dialysis population living in Northern Africa. But PD account for only less than 3% of the dialysis population in Northern Africa. And mainly, we reported many patients in Algeria, in Tunisia, and Morocco. And we have a very low prevalence in Libya, in Mauritania, and probably in Egypt. What about in Sub-Saharan Africa? The majority of patients treated by PD in Sub-Saharan Africa is living in South Africa. More than 1,000 patients. It's around 12% of patients. If you look at the South African Renal Registry. And in Sudan and Senegal, we have a growing PD program. PD exists in some countries, but PD was not available in 50% of countries in Africa, reported by this review. What about this PD program in Africa? As you noted, South Africa, in Sudan and Senegal, they built a PD program sustainable. But in some countries, we have just some experience in some hospital. What about the South Africa PD program? South Africa have 150 nephrologists, more patients on dialysis, but more than 1,000 patients on PD. In Sudan also, they have a lot of many patients on PD, 100. But as you know, in Sudan, with the difficult political situation, they have many problems to solve with PD. And we report in this global dialysis perspective in kidney 360, and we noted that in that report that in Senegal we have more than 1,000 patients on dialysis. The nephrologist is more than 30, but PD count only for less than 5%. Under this experience reported in Peritoneal Dialysis International, the Senegalese PD program, at the beginning, the cost of 1 month of PD was 1,000 euros. But now, free of charge for the patient in the public sector for PD. We worked with Baxter at the beginning of this experience, after it was Fresenius, and now Baxter. And we reported in that experience 60 patients and very young patients with a mean age of 47. The peritoneal rate in Senegal was 0.6 episodes per year. And as you note, Staphylococcus aureus and Pseudomonas were most common bacteria. Late referral of end-stage renal disease is a problem for planning PD catheter. And a large population living in rural setting with limited access to dialysis facilities. And we have a high rate of infection in bad publicity for PD with patients. And in that study, Okpeshi reports the prevalence of peritonitis and mortality of patients in end-stage kidney disease treated with PD in Africa. Around 7 countries, among them Egypt here. And an overall medium peritonitis rate of 0.75 is reported. And the overall median proportion of death was 20%. What about challenges and possible solutions in Africa? In the study done by Nigeria, the survey with the nephrologists and medical practitioner, nurse in dialysis, report that the financial constraints is the most problem for using PD in Africa. And also the inadequate fluid supply and the frequent line blockage infection frequency was reported as the main problem most encountered with PD use. And when PD was first used, the reason of stopping PD usually is the lack of PD catheter, and also the lack of PD fluids, and the lack of expert personnel. And many challenges is the high cost and unavailability of PD fluids, the high rate of peritonitis and catheter-related infection, the unavailability of PD catheter, the low reimbursements of physician and patient unwillingness. And the possible solution for PD development in Africa is the domestic manufacturer for PD fluids, the health professional training, the PP partnership and health insurance, the physician incentive reimbursement, and the patient education and standard of living improvement. How to set up a PD program in Africa? We work with ISN of a dialysis framework for developing dialysis in Africa. And we need equipment and supplies as personal protective equipment, the patient monitoring equipment, PD supplies, PD consumable and medication and treatment. The environment must be good for waste disposal, adequate storage, and we must train the nurse, the nephrologist, and the patient also. And for support services, we must have access to hospital services, access to a backup HD services, water testing and peritoneal access, and access to basic diagnosis, investigation to monitor patient health. And normally for a good PD program also we must have guidelines and documents, education materials, operational protocol, and referral protocols. Sorry?
Could you extend the 2 minutes, please?
Okay. And about the essential requirement for a PD program, out of all these documents, we have some advantage and inconvenience for the PD program. Can we conclude? In conclusion, we note that the PD is a viable techniques in the country, in Africa. But we have to use different solutions for challenges, and we need also a very trained nephrologist for developing PD in Africa. Thank you very much.
Thank you.